Health Commission, Director General Shi Xiaoming from the Environment Research Institute of CDC, and researcher Zhang Liubo from CDC to take questions on the prevention and control in crowding areas, prevention control in public transportation vehicles, and in some special workplaces. Some updates on the pandemic. In the 24 hours of April the 14th, according to reports from provinces, cities, and Xinjiang Production and Construction Corp, new confirmed cases 46, including 36 imported cases. They were in Heilongjiang 14, 13 in Shanxi Province, 4 in Shanghai, 2 in Jilin, in Beijing, Tianjin, Zhejiang, 1 respectively. And 10 were domestic cases, 8 in Heilongjiang Province and 2 in Guangdong Province. New death, 1. Hubei case. New suspected cases, 11, including 10 imported suspected cases. 5 in Heilongjiang Province, 4 in Shanghai, 1 in Liaoning, and 1 was domestic suspected case, which was identified in Liaoning. On the day, newly cured and discharged from hospitals 78, 1,058 close contacts were removed from medical observation. Severe cases were reduced by 3. Imported confirmed cases numbered 904, including 45 severe cases. Remaining suspected cases 72. Cumulatively confirmed cases 1,500. Cumulatively cured and discharged from hospitals 596. There was no death among imported cases as of 24 o'clock April the 14th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases numbered 1,137, including 113 severe cases. Cumulatively cured and discharged from hospitals 77,816. Cumulative deaths 3,342. Cumulatively reported confirmed cases 82,295. Remaining suspected cases 73. Cumulatively traced close contacts numbered 721,295. Close contacts that remained under medical observation 8,309. In Hubei Province, on the day there was no new confirmed case, no remaining suspected cases. Newly cured and discharged from hospitals 39. Remaining confirmed cases 179, including 57 severe cases. All were Wuhan cases. New death 1. Cumulatively cured and discharged from hospitals 64,402, including 47,250 in Wuhan. Cumulative deaths 3,222, including 2,579 in Wuhan. Cumulatively confirmed cases 67,803, including 50,008 cases in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic cases 57, including 3 imported cases. On the day, 7 were transferred to the confirmed case group, including 5 imported asymptomatic cases that were confirmed on the day. 32 were removed from medical observation, including 7 imported cases. Close asymptomatic cases that are still under medical observation 1,023, including 228 imported asymptomatic cases. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,450, including 1,012 in the Hong Kong SAR, 45 in the Macau SAR, and 393 in the Taiwan region. On April the 14th, apart from Wuhan in other cities in Hubei province. For the first time since January the 20th, there was no new confirmed cases nor new suspected cases. Across the country, there has been the highest number of asymptomatic cases, which was numbered 54. That has reminded us to improve the community prevention and control epidemiological survey, conduct precise control measures to make up for any possible loopholes. For asymptomatic cases, asymptomatic infections, as of April the 4th, across the country accumulatively reported asymptomatic infections 6,400 plus, including 588 as imported asymptomatic infections, among which 1,297 were transferred to the group of confirmed cases, including 251 imported asymptomatic infections. 444 were removed from medical observation, among which 109 were from imported asymptomatic cases. Those that remained under medical observation, 1,023, including 228 from imported cases. This has been the update on the pandemic. Now we'd like to open the floor for questions. Please ask questions around today's topic, and please identify yourself before you ask your question. Journalist from the first row on the right side, please. Thank you. With the People's Daily. On April the 9th, Shanghai has declared its school reopening day, and Beijing will declare its school reopening day. As schools are being reopened, what are the measures adopted to enhance the prevention control measures in schools? I'd like to ask Inspector He Qinghua to take the question. Thank you for your concern in the prevention control in schools. As the epidemic prevention control is towards the positive, localities have resumed their business operations, and the school reopening is on their agenda as well. School is a place where there is intensity of people. After school reopening, and there should be special attention paid to the potential risk from imported cases. Only when we can ensure effective prevention and control are in place and the schools are well positioned, can we stagger the reopening of schools. And we should strictly implement the four responsibilities: the catchment accountability, departmental, school, and individual, as well as household responsibility and accountability. A good job should be done in the risk assessment, as well as in the implementation of prevention control measures, emergency preparedness, and emergency drills and response exercises. Schools and the education department and the health institutions should establish a point-to-point and a network coordination. We should be clear that who will be the focal point to contact from either the education department or the health department. For example, I, as the inspector of NHC, can contact moderator as the department head of the publicity department of NHC, Mi Feng. So we should clarify who is to contact whom in case of emergency. It should be a clear focal point network to ensure the full coverage.
Second, to implement the prevention and control measures, we need to emphasize the disinfection and other related control measures are well in place. And thirdly, we need to strengthen health monitoring. The teachers, students, the staff should all be alerted, and any potential absence should be identified, especially for the causes for such absence. Everyone, like the teachers and the students, should cultivate good hygiene practices, like washing hands frequently and appropriately, and ventilate the classrooms. So we need to pay attention to the details in order to guard against any potential cluster cases. Thank you. Let's continue. On the left, the front row, the first reporter in white, please. Thank you. With the CCTV financial channel at the moment, the international spread is accelerating, exerting greater pressure on China. So, in that context, what is the most challenging site and the population? The suggestions for us. Okay, we will have Dr. Shi to take your question. Thank you for your question. For the venues, the enterprises, the population at risk, I think we need to watch closely the following sites and population groups. The first is venues with high risk of exposure or infection. For example, hospitals who take in COVID-19 patients, or the transportation vehicles for potential importation of the pandemic, or the border entry points, etc. As we are faced with increasing pressure on overseas importation. And second, the transportation vehicles which are used by the risk populations, such as the airplanes, the trains, the public buses, and also the friends gatherings or mass gatherings. And thirdly, the closed environment, such as the elevators in the malls, and also venues or population groups which are difficult to follow or monitor. For example, the sanitation staff, they may live in the dormitories, but they may work in different sites. And also, there might be special working units like the nursing homes for the elderly, the orphanages, and the mental health facilities. Because for people in these facilities, their behaviors or their symptoms are difficult to monitor. The second question is about to minimize the risk. I think there are some strategies for even locations which are open. I think the key is to control the flow of the visitors, and also to minimize the short distance or close distance conversation or communication among the people. For entertainment facilities, the suggestion is to remain shut. And also for large-scale sports events or exhibitions, the suggestion is to suspend such large gatherings. For the potential importation of the pandemic, to take strict measures to implement the efforts. All the planned measures should be implemented rigorously. And fourthly, for the special agencies like the nursing homes and orphanages, we need to strengthen the supervision. And also for people in the service sector, we should help them to strengthen their personal protection and also sound ventilation in the business venues or locations. Okay, let's continue on the left, on the second row, the second lady reporter, please. Thank you. With Xinmin Evening News. Recently, the State Council's Prevention and Control Mechanism worked out a policy notice. So my question is, when can people take off the masks? And are there any specific guidance? Okay, we will have Dr. Zhang Liubo to take your questions. I can see there are two questions. Let me answer the first one first. Yes, indeed, the majority of the country is at low risk. However, low risk also means that there are risks. In particular, now we are faced with the importation potential, and also we have population movement, because we want to recover the operation and the production. In this context, we need to guard against the domestic resurgence as well as the overseas importation. So personal protection is still necessary. So talking about the face masks, it's not just a simple question whether we can take it off. Instead, it is part of the personal protection and also the overall pandemic containment. So you have to consider it as a very important part of the pandemic control. Specifically, you need to consider the following issues. First, for the general public, when they are at home or in the outdoor activities with good ventilation, yes, they can take off their face masks. However, if they are in a crowded place, or if they take the public elevators or public transportation, then it's necessary to put on the face masks, especially when you are in close distance with others, say within 1 meter. You need to put on the face masks. And also for people who are working in some specific working occasion or sites like the airports, the prisons, the orphanages, as well as the mental health facilities, yes, you need to put on the face masks. And thirdly, for the key populations, like the patients, the suspected cases, the close contacts, and the inbound travelers, yes, they need to wear the masks. And fourthly, for people with occupational exposure, for example, the physicians, doctors, nurses, police, the security staff, and the sanitation workers, as well as the waiters and the waitresses in the restaurants, they should wear face masks. For your second question, that is about the local specific guidance, well, my understanding is that over the past 3 months or so, localities have already worked out various prevention and control plans and guidelines.
I'm also convinced that localities will contextualize their guidelines according to their conditions and revise where necessary. Thank you. Next question, please. Journalist from the second row from the right side. Thank you. With the CCTV, Premier Li Keqiang explicitly instructed that there should be good health management over those who have left Wuhan after the transportation restriction has been lifted. A lot of people have left Wuhan. What are the targeted prevention control measures? Inspector He Qinghua is taking the question. Thank you for your concern in the post-management after the transportation restriction has been lifted. Yes, indeed. After the transportation ban has been restricted, localities have accelerated the resumption of business, the school reopening, people movement has been quicker. Hubei people, as well as all the Chinese people, will be involved in the efforts to prevent domestic revival and foreign importation of cases. It will be part of our routine efforts, which require holistic and coordinated and integrated efforts across the country. On one hand, we need to refine our measures in the fall earlies. As have been commented by previous experts, the health institutions, fever clinics should play their role in monitoring and reporting the cases. The fever clinics at the grassroots level will play such role, and the face-to-face communication by the epidemiological experts will also play the similar role to identify cases, suspected cases, and close contacts so as to ensure early identification. We should also deepen the epidemiological survey. Once there is any case, we need to pore over the clue and find all possible close contacts and cut off stop the transmission. The hiding of information will be held accountable, and we do not allow any impunity. Third, we will persist with the combination of emergency response and the routine efforts. The risk-zoned approach will be continued. The key places, key organizations, and key population segments will be the continual focus. Meanwhile, we will accelerate the business resumption. However, once there is a case, we must resolutely stamp it out to prevent the transmission from one single case to potential revival. Thank you. Next question, please. Journalist from the third row on the left side. Thank you. With the Economic Daily, in Qingdao City, 2 patients acquired the COVID-19 while they were hospitalized. So what should be the proper measures adopted by hospitals to prevent the further transmission? I'd like to ask researcher Zhang Liubo to take the question. Thank you for your question. We, as you do, watch closely the imported case-related infection in hospital in Qingdao. It is fair to say that our health professionals have been fighting at the front line of this battle, and they are the great warriors. However, we should also note that hospitals is one of the most difficult places where COVID-19 prevention and control are being carried out. And for us, after we have achieved some good results, we should continue with the efforts for a final win. The hospitals are implementing the existing prevention and control measures, and this should be carried on, in particular in the following aspects. First, The health institutions should continue to improve the work by fever clinics. In particular, the triage function should be well managed and standardize the proper procedures for the fever patients so as to realize the early identification, reporting, quarantine, and treatment. Hospitals should continue to follow the online direct reporting system for any infectious disease identification. Second, the hospitals should strictly follow the procedures of disinfection, sanitation, and quarantine. For these two cases in Qingda Hospital, we believe in the fever clinic and in the watching zone of the suspected cases, stricter measures should be taken out in the prevention of cross-infection and the disinfection of the surface of items, and the patient self-safeguarding measures should also be strengthened. Third, the nosocomial prevention is one of the priority of hospitals. Such efforts should be continuously followed, watched, and monitored. The relevant procedures must be strictly implemented. More focus should be focused on the collection and management of medical wastes. Fourth, there should be stricter management of the patients to avoid crowding and the gathering of patients. A better guidance should be carried out in hospitals, stagger the time of their visits, and reduce their waiting time in hospitals. There should be better management over the patients and their family members. Thank you. Thank you. Next question, please. Journalist from the fourth row on the right side, please. Thank you. With people.cn. In Beijing, Shanghai, and other metropolis, these are the major battlefields of the COVID-19 prevention and control. What will be the next steps in these metropolis? I'd like to ask Inspector He Qinghua to take the question. Thank you for your concern in the metropolitan efforts, such as Beijing, Shanghai. Yes, indeed, these are important cities of entries. They are also the important battlefields for the COVID-19 prevention and control. In accordance with the catchment area accountability principle and according to the overall plan by the joint prevention and control mechanism, shortly before, the two municipalities have adopted an array of measures from the quarantine at the points of entry and the divergence of imported and inbound travelers to alleviate the ever-mounting pressure of imported cases at the Beijing Capital International Airport and to enhance the ability of safeguarding the health of the inbound travelers. The Civil Aviation, Ministry of Foreign Affairs, altogether 5 ministries and departments made a joint declaration of adjusting the destination and changed it from the first point of entry to other designated first points of entry to alleviate the pressure in the Beijing Capital International Airport. We'll continue to guide big cities, in particular the cities as points of entries, to accelerate and intensify the screening, closed-loop management, and personnel health management, refine and consolidate the efforts to prevent imported risks. Thank you. Next question, please. Journalist from the third row on the right side.
谢谢主持人。健康报记者提。
Thank you. With JKB. My question is, for different sites, like the orphanages, the nursing homes, the specific requirements. We will have Dr. Shi to take your question. Thank you for your question. for the orphanages, the mental health facilities, and the prisons, yes, they are quite special due to the following features. First, they are quite crowded, and they may not enjoy good conditions for quarantine. Second, the people in these places are quite vulnerable, and the treatment capacity may not be adequate. For instance, for the kids and for the mental health patients. Thirdly, usually in these locations or these units, the importation risk is quite high because the workers working in these locations or the visitors may bring the pandemic with them. And fourthly, once there's an epidemic, it becomes more difficult to implement the control measures. So for these sites, they are quite special. Then in low-risk areas, for these key sites, the following 4 things should be done. The first is the staff working in these sites should pay particular attention to the people, like the kids, the prisoners, the mental health patients, to have sound health monitoring and take their body temperature regularly. And second, try to reduce the external visits and the unnecessary visits. Thirdly, to do a good job with the health monitoring of people who are working in these sites. In case of any abnormality, doctor's advice should be sought before the specific person is allowed to work again. And fourthly, for any suspected symptoms or cases, there should be appropriate quarantine measures. So these are the 4 key measures. Also, apart from these key measures, there should be other measures like the stockpiling of the medical supplies, the setup of the quarantine areas, and etc. And secondly, there should be appropriate ventilation in these sites. Thirdly, once there's a case, then under the guidance of the local CDC, the particular site must be disinfected. So this is for the low-risk areas and the regions. For medium and high-risk areas and regions, these sites should be managed in a closed manner, and there should not be public restaurants open for any gatherings. And also, these sites should remain shut until the appropriate quarantine or monitoring has been completed. Okay, let's continue. On the right, on the third row. Thank you. With China News Service, what are the specific control measures against the asymptomatic infection to minimize the risk of spreading? We will have DG He to take your question. Thank you for your question. Indeed, this is a question of common concern recently. For asymptomatic infection, from the name you can see that these people do not develop symptoms even though their NAT test is positive. Previously, in our epidemiological survey, it was found that these people have the potential to spread the virus. That's why, starting from January the 28th, we have integrated such people into our pandemic control measure, and throughout the country, we adopt a very rigorous measure just as you have found that this is a nationwide effort. So in the third version of the prevention and control guideline, which was released on January the 28th, such cases were identified as also a key target population for close monitoring and unified action. This refers to within 2 hours they should be reported, and within 24 hours the individual case epidemiological survey should be conducted. We have this requirement because by doing so we can identify as quickly and as much as possible the close contacts, and also there should be quarantine and medical observation against such cases and the close contacts. If symptoms develop, then the case would be immediately transferred to the designated hospital for treatment. The second effort is that starting from April the 1st, we have the daily reporting concerning the asymptomatic infection, the newly increased asymptomatic infection, the potential transfer of such cases to confirmed cases are made public. Relevant information is disclosed, and also with our official website, we provide interpretation to such information. And also we have taken various forms like the press conference and experts Q&A to respond to the public concern. At the same time, we have strengthened our communication with WHO so that people can get informed of our information disclosure system and mechanism. And furthermore, for the case reporting and the finding, on April the 6th, in the name of the State Council's joint prevention and control mechanism, we worked out a policy circular concerning the asymptomatic infection. So for these cases, they have to take 2 NAT tests and find their test results negative before they are released from the medical observation. And also, we have a 14-day follow-up study and monitoring concerning these asymptomatic infection. So the localities in China are required to have very stringent medical and quarantine measures. Fourthly, we have expanded the screening scope to the close contacts of the asymptomatic infection, and also for key sites, key regions, and the key population groups, we have strengthened or intensified monitoring measures to maximize the identification of such cases. Fifthly, we have organized expert teams in 9 provinces and municipalities. Simultaneously, we conducted the serological study trying to better understand the epidemiological feature, the pathogens or pathogenesis of the case, so as to minimize the
Hong Kong Economic Herald. Apart from Wuhan, localities have resumed operation. Transportation pressure is mounting in Beijing, Shanghai, Guangzhou, Many are complaining about crowded transportation vehicles, public transportation vehicles. What will the measures adopted? And what are the suggestions for the transportation vehicle riders? Researcher Zhang Liubo is taking the question. Thank you for your question. I remember I have taken similar questions before. However, in this new context, I'd like to reiterate some of the following points. First, in well-positioned places, we still recommend home stay working and the scattered commuting hours. The public transportation vehicles, given their confined spaces and intensity of the riders, they remain the focus of our prevention control efforts. The Public Transportation Authority can organize more rationally the transportation capacity so as to stagger the commuting hours, reduce the crowds, enhance the ventilation, improve disinfection ventilation, and improve the health monitoring of the riders, and give good information on the health promotion and work out the emergency response. If cases occur, they can follow the emergency response plans. As to the recommendations for the public transportation vehicle riders, we have the following tips. First, wear masks. Second, good hand hygiene. In particular, after you disembark from a public transportation vehicle, immediately clean your hands. And third, maximize the usage of contactless payment. Avoid the contacting of any surface or others. Fourth, maximize the distance with others. Thank you. Thank you. Next question, please. Journalist from the second row on the right side, the journalist near the corridor. With the Hong Kong-China review, we are still at a crucial moment of the COVID-19 prevention control. Many businesses are resuming their operation. How should we carry out the prevention and control measures according to the risk-zoned approach? DG Shi Xiaoming is taking the question. Thank you for your question. Risk-zoned and classified approach carries great significance as we are resuming business operation in low-risk regions. Different types and natures of business, apart from the ordinary measures, should pay special attention given their special nature. In particular, the construction companies should follow closely the health status of the workers, in particular the migrant workers who have traveled back to workplaces. The culture, recreational and restaurant hospitality businesses should have good appointment arrangements. The courier deliveries should have the delivery people wear masks. Good ventilation and disinfection of the delivery vehicles. In the vet and fresh market, the crowd intensity should be controlled. Good environmental sanitation should be maintained. Fifth, health and temperature monitoring should be conducted on public transportation vehicles. Disinfection, sanitation, ventilation efforts should be carried out in these public transportation vehicles. Also, researcher Zhang Liubo has shared some other measures, which we also recommend for the higher risk regions, such as Hubei Province, Beijing City, and other cities with moderate to high risks. We should encourage the shortening of working hours or stagger the commuting hours, or the resilient way of working, homestay working, and do not provide a crowd with canteen services. Certain protective measures should also be conducted to ensure the health of the workers as we see the business resuming their business. Next question, please. With the National Economic Daily, how have we identified asymptomatic infections, and how many have we identified? Inspector He Qinghua is taking the question. Thank you for your concern in the identification of the asymptomatic infections. Given the special nature of asymptomatic infections and also the asymptomatic nature, indeed, it's difficult to identify such infections. We have the 5 pathways to identify them. First, among the confirmed and the suspected cases, we look at their close contacts. We proactively test the close contacts of confirmed and suspected cases, and sometimes we identify asymptomatic infections. Second, in the survey of a clustered case, for example, in a restaurant or a community, if we have identified a cluster case with 3 to 4 infected, we proactively test the bigger demographic. Third, during our tracing of transmission source, those who have been exposed will also be tested by us. Fourth, among the imported inbound travelers at the points of entry, if they come from high-risk countries and regions, such an international flight, and there has been the identification of confirmed cases, we will have a proactive testing among a bigger population. And fifth, we have proactively tested and identified asymptomatic infections in our epidemiological survey. So these have been the 5 pathways. Since the 3rd edition of our prevention control guideline has been adopted, we have conducted such consistent method. We have identified 6,764 asymptomatic infections, among which 1,297 have showed symptoms later, and they were transferred to the group of confirmed cases. To the 80,295 confirmed cases. And among the 6,764 asymptomatic cases, 4,444 remained negative during the twice PCR tests, and after the 14 days of quarantine, they didn't show symptoms, and they were removed from this category. And the left, 1,023 among the 6,764 remain under medical observation. Thank you. Next question, please, journalist from the 4th row on the left side with cover news. DG Shi Xiaoming has mentioned the Joint Prevention and Control Mechanism has issued a notice saying that the major sports event and exhibition and expos have to be suspended. What have been the basis of such decision? I'd like to ask DG Shi Xiaoming to answer the question. Thank you for your question. We know the virus transmits through the droplets or direct contacts or the fomites. Therefore, the gathering of people or any crowd may increase the likelihood of cases and transmission. It may also trigger the risk of outbreaks.
We all know that domestically or internationally, basketball players, football players, or in the churches, because of the density of the public gathering, there were outbreaks. And also for marathons or long-distance sports events, as you can see, these events cannot prevent the large gathering during the event and also in other steps of the events, such as registration. Also for athletes, during the sporting events, they will have a higher frequency of breathing and also large volume of breathing. So in case of potential case, the distance of viral spread will also be extended, and this will increase the risk of viral spread. The same is true with the exhibitions and fairs. You know, the exhibitions are usually conducted indoors, and these exhibition halls may not have a good ventilation. Also, the participants or visitors to the exhibitions come from different risk areas, the low ones as well as the high-risk areas and regions. So this has increased the risk of viral spread. Furthermore, during the exhibitions, there are also intimate or close contacts. So this will all lead to higher risk of spread. That's why we suggest to suspend such exhibitions. Okay, let's continue. On the left, on the third row, the first reporter, please. Thank you. With Chinese women news, my question is, now domestically the situation is getting stable and the weather is getting warmer. We have seniors and the young who are eager to go outdoors, especially to the parks. So my question is, what are the specific control measures in public places like the parks? And also, what are the self-protection measures that people should have when they go to the parks? We will have Dr. Zhang to take your question. Thank you for your question. Parks are open public places. They are quite popular among the general public, and it is conducive to people's health and mood. So to visit the parks, I think we should strengthen the health monitoring at the entrance, and also we should ensure the clean environment, especially in sites which are frequently touched by people. Thirdly, it might be appropriate to control the population traffic inside the parks and also to avoid the gatherings and minimize the potential gathering opportunities or chances. For visitors, park visitors, I think personal protection is necessary. Self-protection means first to wear the masks. And of course, you can take the masks with you. Once you find you run into a gathering, then you should immediately put on the mask. And the second, to ensure the clean hands, so the hand hygiene. And thirdly, to avoid the gatherings, and also try to avoid busy and crowded places or activities. And best suggestion is to keep the safe distance above 1 meter. Due to the time constraint, we can only allow 2 questions. Please, on the left, on the 5th row, the reporter, please. Thank you. With China family news. For COVID-19 control, we can see that there are different measures suggested and adopted to low and high risk regions or areas. So what are the criteria? And also, if people or if the businesses violate such rules, what will be the punishment? We will have Dr. Zhang to take your questions. Thank you for your question. It happens that I have the policy document by the State Council with me. This is a policy circular issued by the State Council. I think the question is about the first part, the guiding principle. I think in order to answer your question, maybe I can read the first paragraph. This paragraph is about says that for low risk areas, we should take a science-based approach and take prudent measures. And for entertainment facilities and also the indoor locations, there should be prudent measures for control. I think this paragraph has several components. First, it is about the guiding principle. So it's not a technical guideline for the real practice. It's just a principle requirement. This is my first point. So it is not about the specific criteria and the punishment. Furthermore, you can see that this paragraph emphasizes that the localities should scientifically assess the situation. You know, the current epidemic situation, I think there are 3 features. First, we're faced with a big pressure of overseas importation. Second, we are under the pressure of work resumption and also the increased population movement. Thirdly, the asymptomatic infection is still undergoing the study and investigation. So these are the features of the current situation. And it is also emphasized that we should take a prudent approach. Prudent does not mean review and approval. For being prudent, it means we should take a comprehensive consideration. So it's about comprehensive consideration and planning rather than the review and approval. And fourthly, I want to emphasize in particular that in the second part of the policy notice, it's about the prevention and control suggestions. It specifies that in the current context, in the indoor entertainment facilities, for all the localities, whether low, medium, or high risk, such entertainment facilities should remain closed. So, following the current prevention and control guidance, we suggest to continue the suspension of these facilities.
And the last question is about the penalty for the violators. Well, in Chapter 8 of the Infectious Disease Prevention Law has very specific stipulations, and we will just follow the law. Last question for the day. Journalist from the fourth row on the right side, please. Thank you. With the Shenzhen Special Economic Zone news. Since the outbreak of the epidemic, many old-age nursing homes have been closed. In Zhejiang, Jiangsu, Shanghai, there has been the reopening of these old-aged homes. Will there be unified method across the country? During the COVID-19 response, some of the old-aged citizens haven't been living in these old-aged homes. So will they be quarantined for some days before they can return to the old-aged homes? And what will be the measures adopted for them and also for the family members who will visit them? I'd like to ask DG Shi Xiaoming to take the question. Thank you for your question. Also, I'd like to thank you for your concern of the elder citizens. We know that the old-aged homes are special workplaces. Just like the welfare homes and the orphanages, they need our special care and consideration. The first part of your question is related to the risk zone and classified approach. Therefore, local government will contextualize their specific arrangements of the old-aged home reopening based on local conditions. And the second part of your question is about the old-aged returns to the homes, to their old-aged homes. In low-risk regions, such returned elder citizens don't have to go through quarantine, but in high and moderate risk regions, the returnees need go through quarantine before they can come back to their old-aged homes. And for the elder citizens and family members visiting them need to improve their personal safeguards in the following 5 aspects. First, temperature monitoring should be strengthened. Temperature monitoring is an important component of all these measures. Second, the elder citizens who have chronic diseases and need to depend on the administration of drugs, they should be compliant and should not change the dosage by themselves. If they feel uncomfortable, they need to tell the caregivers. Third, COVID-19 prevention control health tips and science knowledge should be disseminated to prevent the self-decision by the old-aged to take drugs on their own decisions. Next, if they show fevers and other suspicious symptoms, they must be quarantined, and their close contacts should be put under medical quarantine as well. And they need to go through the medical screening. On the fifth, we suggest that the family visiting members use the video way of visiting and minimize the visits. Apart from the 5 above-mentioned aspects, the old-aged homes should continue to provide temperature testing and health screening over the old-aged citizens. I'd like to thank the guest speakers for taking questions on the prevention and control measures in key places, key workplaces, and key population segments. Tomorrow, we will focus on the resumption of business among private businesses and SMEs. We will have MIIT and Industry and Commerce Association Federation, and also the business leaders to share with us their information and take questions. We look forward to your continuous attention. We welcome you to forward us your questions via mailboxes. We conclude today's press conference, and thank you.